Hello, everyone, and welcome to this interview. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to be talking about digital transformation today, and our special guest is Paddy Padmanabhan. He's the CEO of Damo Consulting and co-author of a new book called Healthcare Digital Transformation: How Consumerism, Technology, and Pandemic Are Accelerating the Future. Welcome, Paddy.
Thank you, John. Good to be here.
Yeah, so I'm excited to learn about this, and it's actually kind of a preview for us and for the Healthcare IT Today community, because we have our Expo.Health event coming up, where your co-author Ed Marks is going to be the featured keynote speaker. So this is a nice little preview for that, so people can go check that out at Expo.Health and be part of the interactive experience. But before we dive into this topic of digital transformation, tell us a little bit about yourself and this new book.
Yeah, so I run a healthcare-focused digital transformation advisory firm, Damo Consulting, and the book came about. The idea for the book came about when I did a strategy engagement for Ed, my co-author, who at that time was the Chief Information Officer of Cleveland Clinic. So a lot of the themes in the book and a lot of the ideas in the book actually emerged out of the work that we did together for several months, a couple of years ago. And then we decided that there's an idea for a book in here, and we got around to doing it in late 2019. So that's how I got to the book. And my advisory work continues. So we work with a lot of health systems on their digital strategy, digital roadmaps, technology strategy, things like that.
Excellent. Well, so I'm excited to hear your perspective on this, because we hear a lot about digital transformations accelerating. It's in the title of your book, but is it really accelerating, or is that just kind of hyperbole?
It depends on who you talk to, right? I can tell you, based on my work with health systems and the research that my company does and all the people that I talk to, clearly, there's a bit of a dichotomy in the market. The leading health systems out there, all the brand name health systems, they have been investing in digital transformation for a while, and they've used the COVID-19 situation as an opportunity to accelerate some of their investments because they're in a position to do so. And even though financially everyone's taken a hit in the first half of the year, the ones that were well positioned before the pandemic anyway have taken advantage of the situation and have continued to accelerate their investments. Now, the story may look a little bit different when you talk to the next tier of health systems or smaller, not so profitable health systems, the ones that were struggling before the pandemic. The chances are that they're continuing to struggle even now. And chances are that the pandemic has impacted them more than it has impacted some of the larger health systems. So for them, digital may have slowed down a little bit because they're trying to figure out, how they're going to take care of the here and now, but at the same time, invest for the future. So the story is a little bit different. But if you look at the landscape of the 5,500 or so hospitals out there, I would say the top 100, 200 health systems, they are committing themselves and they are pushing forward with digital transformation. And the bottom half story is a little bit different, and then there's a whole range in between.
So that's really interesting, because I think that's what I want to dive into is what are the characteristics of a healthcare organization that's embracing digital transformation? Is it really about just having those dollars and being profitable enough to invest in it? I mean, so I guess kind of related to that, is digital transformation possible for that bottom half that may be struggling?
It is possible, and not only is it possible, for many it has become an existential issue. Very simple things. If you are in the healthcare services business and you've been suddenly hit by COVID-19 and the traffic, your foot traffic in the clinic or the hospital has come to a complete halt, how do you take care of your patients? You're going to have to turn on some digital capability, even if all you're doing is getting your patients on the phone via Skype or Zoom or any other, even FaceTime, whatever it is that you have gone digital. It's as simple as that.
Yeah.
Now, how do you make that stick? How do you integrate that into your healthcare operations? How do you make it more robust? How do you train your staff? There's a lot of things that go into whether it's a robust enough program to stick for the longer term. But you asked me, how do you know what are the characteristics or the attributes of an organization that is committed to digital? There's a lot of attributes that define the organizations that are a little bit more mature and are making progress with digital. First and foremost, I would say is a commitment at the highest levels of the organization to the transformation itself. It means CEO and the board level. And that commitment has to be visible. And that visibility can come in the form of, maybe a financial commitment of, X million dollars for the next 5 years. And you go out and make a public statement. So that's one form of commitment. Another form of commitment could be that you hire somebody or you appoint somebody to a full-time role as a chief digital officer. That's another form of commitment, right? So you can look for these kinds of indicators and you will know which organizations are truly committed to it and which ones are not. Not that everyone has to have all of these attributes, but when you see an organization that has gone out and made a public statement about their digital goals, gone out and committed to a multi-year investment, gone out and appointed a C-level executive, reporting directly to the CEO of the enterprise, those are pretty strong indicators that they are well on their way. And there's other indicators too, but those are the few that I would begin with, right?
Yeah, I think that's interesting because I think of like Athena Health. They had this program called More Disruption, Please, where Jonathan Bush basically said, hey, we're going to disrupt ourselves, which is a scary thing to do, right? I mean, if you're the CEO of a very successful hospital and you're saying, hey, we're going to transform ourselves and in many ways disrupt our current business, I think that's a scary thing. Is that one of the challenges that is stopping these healthcare organizations from digital transformation?
With healthcare, it's a very unique situation, right? Most of healthcare today feeds off of the fee-for-service model, which
Right.
means there is a strong incentive to let the status quo continue. As long as you don't have a compelling reason to change, because you're earning your revenues through a fee-for-service model, the compelling reason to change is not there. But once in a while, something comes along like COVID-19, which is a black swan event, and now you have to change because there's no way you're going to get patients into the hospital. So if you want to serve your patients, if you want to keep the revenues coming in, you have to necessarily go digital. And then what you do is you look at it. Now, we just did some research with in partnership with Chime, and we asked this very simple question: has COVID-19 been an opportunity for us, opportunity for you, or has it become an existential threat for you? The answer is a bit of both. Right? COVID-19 has definitely impacted the finances of the enterprise in the short term, but it is also an opportunity to completely, in your own words, disrupt yourself and prepare for the inevitable future, which is going to be digital health. So it's not healthcare alone. You talked about Athena Health, but there are other very visible examples of companies that have gone through these creative destruction, the Schumpeterian model of destruction, creative destruction. A great example of that is Netflix, right? They disrupted themselves. They got rid of all the DVDs. I remember the time I used to get DVDs in the mail, and now no one remembers that because they disrupted themselves and went to streaming media. It was a huge bet. So healthcare in some ways will have to make those bets, and some of them are already making those bets. Great example, a week or two ago, I saw that Kaiser had launched an insurance plan, which is virtual care only, right? It's a
Wow.
great new innovation. So
Yep.
you buy insurance, and the care that you're going to receive, most of it's going to be through virtual means, right? So telehealth, remote care, and so on. So those kinds of models will emerge as well, and we are, in very early stages of these kind of changes. COVID-19 has certainly accelerated it, kind of pushed it over the edge in some ways, but there are other competitive forces in the market, non-traditional players like CVS and Walgreens and Walmart on the one hand, but a lot of emerging tech firms, right, that can come from left field and disrupt your business. So it all remains to be seen. It's all up in the air.
Yeah, that's really interesting about Kaiser. It's almost like a virtual care first, kind of like mobile first development. It's virtual care first health insurance, which is a really fascinating way to approach it.
Yeah, who knows? Maybe other health systems will follow now, and now it'll become very commonplace. Health insurance companies. It might become very commonplace that everyone has a plan now where you can go all virtual. And if you're a young, healthy millennial who doesn't go to the clinic anyway,
Yeah.
right, and you're going to get an insurance policy that's half the premium that you're paying today, hey, sign me up, right?
I mean, I'm not a millennial and I'm ready to sign up. So I guess there's that too. So, where are you seeing the transformation? Is it really along those lines that COVID-19 forced around virtual care, or do you see other digital transformation opportunities that are happening at these organizations as well?
So let's talk about prior to COVID-19.
Sure.
Prior to COVID-19, when you talked about digital transformation, most of the time they were, organizations would be talking about digital front doors. That's another term that you would have definitely heard. It's about digital engagement with patients, right? And post COVID-19, the need for improved digital engagement has only grown because you don't have any other mode of engaging with the patients. You had to engage digitally. So that's really kind of picked up. The other things that have picked up, there's a couple other things that have happened. The larger enterprises are recognizing that if you want to go full on with your digital programs, you need to have a very robust IT foundation and infrastructure, both at the infrastructure level as well as at the application level. So, you've got your big monolithic EHR systems on the one hand, and then you've got your infrastructure. And you've got to really upgrade your infrastructure in order to be able to support these new digital engagement models, right? And to do that, you have to invest in transforming your backend as well. So it's not just the front end, but it's also the back end. And on top of all of this, new modalities have come into existence. A great example of a brand new modality that COVID-19 has created is the need for low contact or contactless experiences. No one cared about contactless experiences before because coming in contact with your healthcare provider was not considered to be a risk. But now it's considered to be very high risk. So there was a Power Panel CEO survey that Modern Healthcare did a while back, and they did a commentary on that in which I was actually quoted. I liken this to the arrival of drive-through experiences in healthcare. Just think about this, right? In a low contact, no contact kind of an environment, what do? You really basically do everything, as much of it as you can, online. You schedule the appointment, you make your copay payment, insurance verification, all of that stuff, all the forms you fill, everything is done online. And you drive up to your clinic and they know you've arrived because you've turned your location finder on and they've geo-tracked you and they tell you, we know you're here, sit tight, we'll call you when we're ready. And then when they're ready for you, they call you in, you go in, you don't meet anybody in the lobby or anything. You go straight through, meet your provider, you're there for whatever you came for, you spend a half hour, an hour, whatever, and then you're on your way. It's almost like a Starbucks experience for me. So that's the new modality that's come about as well. So talk about digital transformation, right? It's been brought on completely because of COVID-19. There was no such need prior to this. And even when you enter a clinic now, you don't want to touch anything. So things like facial recognition, biometric identification, these kinds of things, where you don't touch anything, right? those are going to become more and more prominent in the experience.
Yeah, my favorite piece of that experience is a number of companies that are working on what's your wait time. Because if I'm sitting in my car, I have a different expectation than if I'm sitting in an exam room, which is kind of weird to think about, right? Like, why should that be any different? But it's going to really expose those providers who have long wait times, because waiting in the exam room is a pain for an hour, but at least I might go from the waiting room to the exam room to the nurse seeing me, and so it kind of feels like it's shorter. But if I'm sitting in my car for an hour, you know, my gas runs out, what's going to happen? That's a scary experience, right?
Sure, and this is all new, so no one's suggesting that this has all been worked out, right?
Sure.
It's going to take a while, but they will iron out the kinks over time, and hopefully these experiences will become more seamless. You know, we're all, I mean, I don't know about you, John, but I'm not ready to go back to a clinic just yet. I'm trying to do as much of it offline as online as possible. Right?
Yeah, absolutely. So it's interesting you talk about the infrastructure that's needed and having a good infrastructure that scales to this new digitally transformed world. But you know, I want to talk about the EHR, which is something we've written a lot about over the, you know, thanks to meaningful use and all that. But is the EHR a help or a hindrance to this digital transformation?
I would say the EHR is foundational to digital transformation because it is your system of record. It is where your patient data resides. And anything that you're going to do that's going to transform the experience for your patients, for your providers, is going to have to rely on the electronic health record system for the most basic information that's going to enable those experiences. So I would say the EHR systems are absolutely foundational. So we have a 4-stage model that we use in my firm, which assesses the digital maturity of healthcare enterprises. The most basic level of maturity, which is model 1, is where health systems are using their EHR platforms for everything, including their digital transformation. And you know, EHR systems have come a long way since the early days of meaningful use, at which time it was mostly maybe to do with just billing. And even today, a lot of it has to do with billing. But they've come a long way in terms of building capabilities, including video consults, including you know, online scheduling, you know, your mobile applications for communications between patients and caregivers. So they've come a long way. But the marketplace needs have evolved much more than what you can possibly get out of EHR. So that's where you need to kind of build on top of the EHR, find best-in-class tools out there, build best-in-class experiences. And then don't forget the back-end IT infrastructure. So if you kind of go across the model 4, which is our most mature, they all, you know, they have very robust EHR environments. They've kind of optimized it. They operate a very smooth EHR platform, and they've kind of figured out how to do that, because that's foundational. If you're not doing well with your EHR, everything else downstream is going to be impacted. And so they build on top of that. And you know, that's what we are seeing. So the short answer to your question is EHR is foundational. I won't call it, you know, a hindrance by any means, but I wouldn't call it the final word on digital enablement either.
Gotcha. It probably depends on how they implemented it, right? You know, it could be a hindrance if you've implemented it poorly, and if
That is
you've
correct.
implemented it well, then it can be a help. And
That is correct.
I like the idea of foundational.
Yeah.
Yeah. So just kind of wrapping things up, you know, and I think we could talk about your 4 stages. I mean, there's so much to talk about here, but kind of wrap up this interview. What's the thing that gets you most excited about what's happening in healthcare transformation?
I think the one thing that excites me the most is the renewed focus on the consumer. Right? Today, the consumer is truly front and center for health systems for a variety of reasons, especially in the context of digital transformation. COVID-19 has imposed a situation on all of us that requires most interactions to be digital in nature, whether it's a whether it is audio, video, whether it is asynchronous, synchronous, doesn't matter. The need of the hour is to have a seamless and reliable digital engagement model. And that necessarily means that providers have to up their game in order to engage seamlessly with their patients or patient consumers, who in turn have raised their expectations because they're used to certain levels of service and a certain quality of experience from the best-in-class digital platforms out there. Take your pick, whether it's Apple or Amazon or Starbucks or any of them. They're beginning to expect that from, at least some part of it from healthcare. And the good news is that I think there's all-around recognition that patients have to be provided that experience. And we're still in early stages, but that renewed focus on the consumer is what really gets me excited, because all the conversations that I have, all the research that we do, all the work that we do for our clients is very much indicative of this renewed focus and the renewed commitment to improving those experiences. So that's what I really feel good about.
That's great. I can hear all the patients rejoicing right now because they hadn't been in the center before. So that's great. Yeah, so thanks for sharing all these ideas on digital transformation. Be sure to check out the book. Paddy and his co-author, Ed Marks, have written the book Healthcare Digital Transformation, easy to find on Amazon, online. You can find it there. I think if you look on Twitter, I know I've seen Ed just signing a bunch of books too. So I think there's some signed copies, which is the way I like to get books. So check that out on Twitter as well if you want a signed copy, but check out Healthcare Digital Transformation. And we'll put a link in the notes as well for this interview. So thanks so much, Paddy, for sharing this. And if you want to find out more great content like this, be sure to check it out at healthcareittoday.com. And also check out his co-author, Ed Marks, who's giving the keynote at the Expo.Health event in October. Thanks so much, Paddy. I appreciate you sharing.
Thank you for having me, John. Bye now.